All right, 5 years ago today, as we record this, New Zealand went into our first COVID lockdown. It was the start of a time that none of us really wants to remember, but that we'll never forget. We are going to get Sir Ashley Bloomfield's recollections of COVID, but we're also, importantly, going to get his reckons on the current health system and his plan for getting us out of the mess that we are currently in. Sir Ashley Bloomfield, thank you for being on the FN News. Did you wake up this morning and reflect? You know, how does this anniversary work for you?
Well, thanks, Paddy. I mean, it was a heck of a time, and large parts of the whole COVID experience are a blur for me now. But that week or so before the first lockdown is really vivid in my mind, and I expect most Kiwis do have quite a strong memory of that time because we were all scared. I mean, this thing was unfolding at pace. It was causing chaos in a number of countries around the world, and so we were scared, we were anxious, but there was a high level of support for the lockdown, and so, you know, it was kind of the start of really an amazing experience over the subsequent 2.5 years.
So when you woke up this morning, what did you think? 5 years on, you know, how does Ashley Bloomfield reflect on that?
Well, the first thing was, I'm sure glad it's not 5 years ago, because it was a harrowing time, you know, wondering what was going to happen, thinking about what advice to give, waking up in the middle of the night, worrying about what to do. And it was a challenging and harrowing time for everybody in New Zealand. We should really acknowledge that. And in many respects, though, there was somewhat of a sense of relief when that decision was taken and we went into the lockdown, despite the challenges of it, because there was wide support for it. You know, over 90% of Kiwis trusted that was the right thing to do at the time. And so whilst it was something none of us had expected would happen, it also, I think there was a kind of people got it and embraced it.
And do you, sitting here today, 5 years on, have any regrets whatsoever about locking New Zealand down?
Yeah, I don't about that. And in fact, all the evidence is showing, and even the first stage of our COVID inquiry, you know, they concluded that actually lockdowns were a really important part of our response to keep people safe. And we were not the only country to do this. We were not the first, nor were we the only. The thing that we got right, though, was the timing. Hard and early. And actually, as it transpired, our lockdowns weren't as long as they were in many other countries. I was talking to a chief exec of a major firm here in New Zealand just last week, and he was in Seattle at the time. They were in lockdown for a year. A whole year, whereas we had those periods in New Zealand where we were in elimination, where we were essentially able to carry on our lives normally.
5 years on, some quick fire questions here about the pandemic. What are you most proud of in terms of decision making at the time 5 years ago? What's one thing that stands out, quick fire?
Taking the big decisions with not much information at the right time.
All right, and what did you get wrong? And again, quick fire, you know, is there something that stands out that you got wrong?
Well, as things went by and people's kind of tolerance waned, I think we could have done more listening, you know, because even just active listening and hearing people's concerns and telling them a bit more about the pros and cons of what we were doing, that might have helped.
And quick fire, what would you do differently if you had your time again?
What I'd do differently is I'd keep a diary because it's all a bit of a blur now. But the one other thing I'd do is I'd task one of my senior people with just being responsible for pastoral care of the people in the organisation, because it was absolutely challenging and some of them burnt out. And, you know, I didn't have the bandwidth to kind of see that happening. And so I'd put a bigger focus on pastoral care of our people.
And a bit of a fun question here, a few requests from people in the office for, you know, you to redo the greeting that you would do when you came down to those beehive briefings. How did it go when you came down each time? Kia ora tātou. Can you remember how to do it?
Yeah, kia ora koutou katoa. This is not a COVID-19 announcement.
This is not. That is good. And Ashley, Sir Ashley Bloomfield, you're one of the great sort of health leaders, one of the most experienced health leaders we've got. We're constantly seeing now that the health system is under stress. You know, many people will say it's broken. You know, what do you think when people say the health system is broken?
Yeah, I struggle with this this idea that everything is a crisis or that the system is broken, because every day there are great people working in the system delivering fantastic care. despite the challenges. And those challenges are neither new nor are they unique to Aotearoa. So just calling out the crises and the failures and saying things are broken is not enough. And in some ways, I think it takes agency away from people, that they feel that there's no hope. Actually, there's an enormous amount of hope that we should have in our current system, but also that we can overcome these challenges if we really focus on it, like we did through COVID. And the thing about hope, which I think is an important thing, certainly for people working in our system, is it's optimism, which is a good thing, positivity, plus a plan. And what people are looking for in the system, and I think Kiwis are looking for, is a sense of hope. The system can get better, it can deliver, because we've got all the ingredients in this country for that to happen. What it will really require, though, is for us to take a bit of a longer-term view. And I'm talking with a lot of people around, let's take a 10-year view of the system. Where do we really want to be in 10 years' time? And let's come up with a plan and work our way towards that.
So that's what we need, in your eyes, something practical, a 10-year plan for the health system that gives people working in it and people outside it hope and a way ahead, something positive. Is that your idea here, a 10-year plan?
Yeah, exactly. Taking a 10-year horizon is helpful because it's 3 electoral cycles for a start. So it puts it beyond those immediate kind of electoral, or the upcoming election and the partisanship that plays out around that. But most people can look back 10 years to 2015 and they think, gosh, was that only 10 years ago? But things were quite different. So it's a period of time you can really make a difference. You can make a difference to training your workforce. You can make a difference to investment in buildings and data systems and so on. And you can, most importantly, you can make a difference in really investing in primary care, which is a huge need that we need to follow in this country, but also other countries going down that track as well.
And would this be bipartisan, Sir Ashley? Are you talking about a bipartisan 10-year plan that both sides agree to, so it's not sort of changed each time a different government gets in? Would that be the ideal?
Well, one of the conversations I'm having with a lot of people, including in the business side of things, the private sector, but certainly in the health system, is getting as much of a bipartisan or multi-party sort of approach to these things would be really helpful, just as we're trying to do around infrastructure and some of these other really key things we need to take a longer-term view of. So I would hope that, that we can sort of, you can't take the politics out of healthcare, but taking as much as possible a non-partisan approach to agreeing on, what is it we want our system to look like, and here are the key things we need to do. Not a strategy, not a vision, but actually a clear plan that takes us to achieving that over 10 years.
What would the next practical steps be for this in terms of getting people together to agree to a 10-year plan? Have you thought that far ahead?
Yeah, actually just convening people. One of the things it's been a real privilege I've done since finishing as DG is I was involved in co-chairing a negotiation at the WHO, 196 countries. 42 days and several nights of negotiations to actually agree some pretty big amendments to the international health regulations. If you can get 196 countries in today's world to agree unanimously to those changes, I would have thought in little old New Zealand we can convene the people who might really want to put some energy and thought and hope into developing up that plan.
So you're very optimistic about achieving this. Are you putting your hand up to convene this group, basically, is what I'm asking you. Are you putting your hand up to convene a group that would look for a 10-year plan for the New Zealand health system that could be bipartisan? Is Sir Ashley Bloomfield putting his hand up to do that?
I'm putting my hand up to be part of it. I'm not going to self-appoint myself, I'm not going to appoint myself as a convener, but I'm really interested in this. And everyone I talk to, from Business New Zealand, from people working in the private sector to colleagues working in the health system and the public sector, see that this is a good way for us just to lift our gaze and to start looking at what is it we actually can do to address the challenges. Again, just to reiterate, they're not unique to New Zealand and they're not unique to now.
And how long will it take to do this? I mean, can you do it this year? Is this something that can happen? Is there the groundswell behind this? You've obviously done some work on it.
Well, I think getting started is the key thing. And if you look at how quickly we were able to respond to COVID, where there's absolute clarity of purpose, where there's energy and commitment, and I have no doubt there is plenty of that across the system, then you can make quite rapid progress.
And would you like the government to help get on board with this? Are you sort of calling on the government to get in behind this in some way, the current government?
Yeah, I don't think it's my place to call on the government to do it, but I'd hope that if people started to convene around this idea and come up with some good analysis and some good proposals, both the government and also parties who are currently in opposition would look at those proposals seriously and think about, gosh, how might we be able to actually take those forward.
And have you got a name for this yet in mind? Is there any kind of name for this concept? Or what?
Not at the moment, no. I'm just kind of floating the idea. But one of the things I'm really interested in is giving New Zealanders a strong sense of trust and confidence in the system. I think that's been undermined, and it's undermined, by all the stories of things going wrong. Whereas when you talk to people who've had experience of the health system, the vast majority of them are really positive about that experience, about the care they received, about the quality of the people they interacted with. And so we need to kind of capture that and I think build on that.
And coming back to COVID, you've brought it up a couple of times, and something strikes me while I'm talking to you on the 5-year anniversary. Very few people in this country would know what it's like to be so loved as you were at one point in that, the tea towels, everybody knows that, but also I'm sure very hated in subsequent points as well, to the potential, no doubt, of threats and that kind of thing. What is it like as a human being being loved and hated at the same time? Because it must be difficult.
It's not too difficult for 2 reasons, Paddy. I've got the words of my mother ringing in my ears. You can please some people some of the time, but you can never please all of the people all of the time. And that's something I've always held. You do your level best, and not everyone's going to like what you do, whether it's in the role I was in or the role you're in. You're recognisable. I'm sure some people love your work and there'll be others who are not quite so supportive of it.
That's for sure.
And certainly there were figures, and there are figures who are in the mainstream media who also take a bit of a pasting from a small group of people. But the other thing that gets me through the days is actually the feedback I get from people on a daily basis, face to face, where people will just come up to me spontaneously and are really grateful for what the team did, what we did as a country, and reflect on that. And I guess if there's one thing that I think is our greatest achievement as a country through COVID, and the one we need to really focus on, is when that first lockdown happened, the reason we did so well as a country is we grounded ourselves in the things that actually most Kiwis believe in: decency, looking after each other, kindness, respect for each other, trust. And if we could capture that and focus on that, instead of some of the kind of polarisation that seems to be fashionable at the moment, I think we'd go a long way to addressing some of those really big challenges we face, not just our health system, but other things like child poverty, homelessness, and the environment.
All right, Sir Ashley Bloomfield, thank you very much for your time here on This Is the Effin News.
Thanks, Paddy.